Comprehensive NCLEX RN Practice Exam 10-2026. Question 1. The nurse should visit which of the following clients? First, A. The client with diabetes with a blood glucose of 95 mg/dl. B. The client with hypertension being maintained on lisinopril. C. The client with chest pain and a history of angina. D. The client with Raynaud's disease. Chest pain is a high-priority cardiac symptom, ABCs. The other clients are relatively stable or have normal findings, blood glucose of 95. Question 2. A client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication. A. Once per day in the morning. B. 3 times per day with meals. C. Once per day at bedtime. D. 4 times per day. Pancreatic enzymes must be taken with every meal and snack to facilitate the digestion and absorption of fats, proteins, and carbohydrates in patients with cystic fibrosis. Question 3. Cataracts result in the opacity of the crystalline lens. Which of the following best explains the functions of the lens? A. The lens controls stimulation of the retina. B. The lens orchestrates eye movement. C. The lens focuses light rays on the retina. D. The lens magnifies small objects. The primary function of the lens is to bend and focus light rays accurately onto the retina to create a sharp image. Question 4. A client who has glaucoma is to have miotic eye drops instilled in both eyes. The nurse knows that the purpose of the medication is to A. Anesthetize the cornea. B. Dilate the pupils. C. Constrict the pupils. D. Paralyze the muscles of accommodation. Miotics, like pilocarpine, constrict the pupil, which pulls the iris away from the drainage channels, allowing aqueous humor to outflow and reducing intraocular pressure. Question 5. A client with a severe corneal ulcer has an order for gentamicin GDTQ 4 hours and neomycin 1 GDTQ 4 hours. Which of the following schedules should be used when administering the drops? A. Allow 5 minutes between the two medications. B. The medications may be used together. C. The medications should be separated by a cycloplegic drug. D. The medications should not be used in the same client. When administering two different ophthalmic medications, a 5-minute gap is necessary to prevent the second drop from washing out the first one. Question 6. The client with color blindness will most likely have problems distinguishing which of the following colors. A. Orange. B. Violet. C. Red. D. White. Red-green color blindness is the most common form of color vision deficiency. Question 7. The client with a pacemaker should be taught to A. Report ankle edema. B. Check his blood pressure daily. C. Refrain from using a microwave oven. D. Monitor his pulse rate. Patients with pacemakers must be taught to monitor their own pulse rate to ensure the device is maintaining the set heart rate correctly. Question 8. The client with enuresis is being taught regarding bladder retraining. The nurse should advise the client to refrain from drinking after A. 1900. B. 1200. C. 1000. D. 0700. Restricting fluids in the evening, after 1900 or 7 p.m., helps reduce the volume of urine produced at night, which is a key strategy in managing nocturnal enuresis. Question 9. Which of the following diet instructions should be given to the client with recurring urinary tract infections? A. Increase intake of meats. B. Avoid citrus fruits. C. Perform peri-care with hydrogen peroxide. D. Drink a glass of cranberry juice every day. Cranberry juice contains substances that prevent bacteria, like E. coli, from adhering to the walls of the urinary tract. Question 10. The physician has prescribed NPH insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? A. I will make sure I eat breakfast within 2 hours of taking my insulin. B. I will need to carry candy or some form of sugar with me all the time. C. I will eat a snack around 3 o'clock each afternoon. D. I can save my dessert from supper for a bedtime snack. NPH is an intermediate-acting insulin that typically peaks 4 to 12 hours after administration. For a morning dose, the peak and highest risk of hypoglycemia occurs in the late afternoon. Question 11. The nurse is caring for a 30-year-old male admitted with a stab wound. While in the emergency room, a chest tube is inserted. Which of the following explains the primary rationale for insertion of chest tubes? A. The tube will allow for equalization of the lung expansion. B. Chest tubes serve as a method of draining blood and serous fluid and assist in re-inflating the lungs. C. Chest tubes relieve pain associated with a collapsed lung. D. Chest tubes assist with cardiac function by stabilizing lung expansion. Chest tubes are inserted into the pleural space to remove air, pneumothorax, or fluid/blood, hemothorax, restoring negative pressure and allowing the lung to re-expand. Question 12. A client who delivered this morning tells the nurse that she plans to breastfeed her baby. The nurse is aware that successful breastfeeding is most dependent on the A. Mother's educational level. B. Infant's birth weight. C. Size of the mother's breast. D. Mother's desire to breastfeed. Psychological factors, including the mother's motivation and desire to breastfeed, are the strongest predictors of breastfeeding success. Question 13. The nurse is monitoring the progress of a client in labor. Which finding should be reported to the physician immediately? A. The presence of scant bloody discharge. B. Frequent urination. C. The presence of green-tinged amniotic fluid. D. Moderate uterine contractions. Green-tinged amniotic fluid indicates the presence of meconium, which can be a sign of fetal distress and carries a risk of meconium aspiration syndrome. Question 14. The nurse is measuring the duration of the client's contractions. Which statement is true regarding the measurement of the duration of contractions? A. Duration is measured by timing from the beginning of one contraction to the beginning of the next contraction. B. Duration is measured by timing from the end of one contraction to the beginning of the next contraction. C. Duration is measured by timing from the beginning of one contraction to the end of the same contraction. D. Duration is measured by timing from the peak of one contraction to the end of the same contraction. Duration is the length of time a single contraction lasts, from start to finish. Frequency is the time from the start of one to the start of the next. Question 15. The physician has ordered an intravenous infusion of Pitocin for the induction of labor. When caring for the obstetric client receiving intravenous Pitocin, the nurse should monitor for A. Maternal hypoglycemia. B. Fetal bradycardia. C. Maternal hyperreflexia. D. Fetal movement. Oxytocin, Pitocin, can cause uterine hyperstimulation, which reduces blood flow to the placenta and can result in fetal distress, manifested as bradycardia or late decelerations. Question 16. A client with diabetes visits the prenatal clinic at 28 weeks gestation. Which statement is true regarding insulin needs during pregnancy? A. Insulin requirements moderate as the pregnancy progresses. B. A decreased need for insulin occurs during the second trimester. C. Elevations in human chorionic gonadotropin decrease the need for insulin. D. Fetal development depends on adequate insulin regulation. As pregnancy progresses, especially in the second and third trimesters, placental hormones cause increased insulin resistance, requiring higher, moderated, doses of insulin. Question 17. A client in the prenatal clinic is assessed to have a blood pressure of 180/96. The nurse should give priority to A. Providing a calm environment. B. Obtaining a diet history. C. Administering an analgesic. D. Assessing fetal heart tones. In the presence of severe hypertension, preeclampsia, the priority is to assess the well-being of the fetus to ensure it is not being compromised by reduced placental perfusion. Question 18. A prima gravida, age 42, is 6 weeks pregnant. Based on the client's age, her infant is at risk for A. Down syndrome. B. Respiratory distress syndrome. C. Turner's syndrome. D. Pathological jaundice. Advanced maternal age, over 35, is a significant risk factor for chromosomal abnormalities, specifically trisomy 21, Down syndrome. Question 19. A client with a missed abortion at 29 weeks gestation is admitted to the hospital. The client will most likely be treated with A. Magnesium sulfate. B. Calcium gluconate. C. Dinoprostone, Prostin E. D. Bromocriptine, Parlodel. Dinoprostone, a prostaglandin, is used to induce uterine contractions to expel the products of conception in a missed abortion or to ripen the cervix for induction. Question 20. A client with preeclampsia has been receiving an infusion containing magnesium sulfate. Deep tendon reflexes are 1+, urinary output is 100 ml. The nurse should A. Continue the infusion of magnesium sulfate while monitoring the client's blood pressure. B. Stop the infusion of magnesium sulfate and contact the physician. C. Slow the infusion rate and turn the client on her left side. D. Administer calcium gluconate 4 push and continue to monitor the blood pressure. Loss of deep tendon reflexes, 1+, and decreased urinary output are early signs of magnesium toxicity. The infusion must be stopped immediately. Question 21. Which statement made by the nurse describes the inheritance pattern of autosomal recessive disorders? A. An affected newborn has unaffected parents. B. An affected newborn has one affected parent. C. Affected parents have a 1 in 4 chance of passing on the defective gene. D. Affected parents have unaffected children who are carriers. In autosomal recessive disorders, both parents are usually unaffected carriers. Each child has a 25% chance of being affected. Question 22. A pregnant client, age 32, asks the nurse why her doctor has recommended a serum alpha-fetoprotein. The nurse should explain that the doctor has recommended the test. A. Because it is a state law. B. To detect cardiovascular defects. C. Because of her age. D. To detect neurological defects. Alpha-fetoprotein, AFP, screening is used to identify potential neural tube defects, like spina bifida, or chromosomal abnormalities. Question 23. A client with hypothyroidism asks the nurse if she will still need to take thyroid medication during the pregnancy. The nurse's response is based on the knowledge that A. There is no need to take thyroid medication because the fetus's thyroid produces a thyroid-stimulating hormone. B. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. C. It is more difficult to maintain thyroid regulation during pregnancy due to a slowing of metabolism. D. Fetal growth is arrested if thyroid medication is continued during pregnancy. Pregnancy affects thyroid hormone levels and metabolism, often requiring dose adjustments and more frequent monitoring to maintain a euthyroid state. Question 24. The nurse is responsible for performing a neonatal assessment on a full-term infant. At 1 minute, the nurse would expect to find A. An apical pulse of 100. B. An absence of tonus. C. Cyanosis of the feet and hands. D. Jaundice of the skin and sclera. Acrocyanosis, cyanosis of the hands and feet, is a normal and expected finding in the first 24 to 48 hours of life due to immature peripheral circulation. Question 25. A client with sickle cell anemia is admitted to the labor and delivery unit during the first phase of labor. The nurse should anticipate the client's need for A. Supplemental oxygen. B. Fluid restriction. C. Blood transfusion. D. Delivery by cesarean section. Labor increases the metabolic demand and stress on the body. For a client with sickle cell anemia, supplemental oxygen helps prevent sickling of RBCs. Question 26. A client with diabetes has an order for ultrasonography. Preparation for an ultrasound includes A. Increasing fluid intake. B. Limiting ambulation. C. Administering an enema. D. Withholding food for 8 hours. For a pelvic ultrasound in early pregnancy, a full bladder is required to push the uterus up and out of the pelvis for better visualization. Question 27. An infant who weighs 8 pounds at birth would be expected to weigh how many pounds at 1 year? A. 14 pounds. B. 16 pounds. C. 18 pounds. D. 24 pounds. A general rule of thumb for infant growth is that birth weight doubles by 5 to 6 months and triples by 1 year of age. Question 28. A pregnant client with a history of alcohol addiction is scheduled for a non-stress test. The non-stress test: A. Determines the lung maturity of the fetus. B. Measures the activity of the fetus. C. Shows the effect of contractions on the fetal heart rate. D. Measures the neurological well-being of the fetus. A non-stress test, NST, monitors fetal heart rate accelerations in response to fetal movement, activity, to assess fetal oxygenation and autonomic nervous system function. Question 29. A full-term male has hypospadias. Which statement describes hypospadias? A. The urethral opening is absent. B. The urethra opens on the dorsal side of the penis. C. The penis is shorter than usual. D. The urethral meatus opens on the underside of the penis. Hypospadias is a congenital condition where the urethral opening is on the ventral, underside, of the penis rather than at the tip. Question 30. A gravida 3 para 2 is admitted to the labor unit. Vaginal exam reveals that the client's cervix is 8 centimeters dilated, with complete effacement. The priority nursing diagnosis at this time is: A. Alteration in coping related to pain. B. Potential for injury related to precipitate delivery. C. Alteration in elimination related to anesthesia. D. Potential for fluid volume deficit related to NPO status. At 8 centimeters dilation, transition phase, contractions are most intense. The client often experiences a loss of control and difficulty coping, making this the priority diagnosis.